First of all, for archiving purposes, say your full name and spell it for me.
Okay.
Okay, do that.
Okay. Berta, B-E-R-T-A, Cabrera, C-A-B-R-E-R-A.
And what's your official title?
Executive Director.
Okay. Of?
I'm the Executive Director of SSJ Health Foundation and St. John Bosco Clinic. SSJ, is this filming? Or?
Yeah, it's going.
Where should I look?
Well, this is just for archiving.
Right,
so
but when I'm
but
speaking...
you're going to look and talk to me.
To you.
Yeah.
Okay, perfect.
Yeah.
SSJ Health Foundation is the philanthropic arm that supports the St. John Bosco Clinic.
Okay. So I guess we could start in the beginning. What brought you here to this place?
What brought me to St. John Bosco Clinic is a long story that I'll make a short story. My training is in social work, and I originally started working at Mercy Hospital 26 years prior to coming to the clinic as a social worker. And eventually my position changed within the hospital, but I always thought that I needed to go back to what I was meant to do. And at the time of the sale of the hospital, I made a decision that it was time for me to move on. And the clinic and the foundation that sponsors the clinic were not part of that transition. And I applied for the position, and I was very blessed to have received the position of Executive Director for the foundation and the clinic. It has been a life-changing experience to work at this clinic. I come with the history and the knowledge of the Sisters of St. Joseph, who I've heard and knew about since I was a child growing up in Miami. I used to think that Mercy Hospital was the only hospital in town because that's where everybody in my family ever went. And that's where I went as a student to do a rotation in social work school. My field placement was at Mercy. So I came to know the sisters and really understand their commitment, not only for the health care of the person, but for the person as a whole. And their support of social services at the hospital was wonderful. And it allowed us to really practice social work and take care of the whole individual. At the time that I left and I came to the clinic, I walked in here and there was this sense of coming home. There was a sense of bringing everything back together to what I feel I was meant to do. And so the clinic has continued now for 4 years since the separation from the hospital. And along with the sisters and our board, we have incredible support from volunteers. The clinic only employs 6 individuals. All of the work in this clinic is done with the support of volunteers and with this incredible support of physicians who volunteer their time and their talent to see our patients. We have over 25 volunteer physicians in all specialties, and we also partner with other organizations, including the University of Miami Docs program, and many organizations that support what we do and partner with us to take care of individuals. At the clinic, there isn't a normal average day. No 2 days are alike. But what the clinic does is that it serves children, it serves adults, it serves families that are otherwise unable to access healthcare in our community. Individuals who are unable to afford health insurance, even in an era where there is the marketplace for insurance, there are many individuals that fall in the gap and are still not covered. And those are the individuals that we take care of. Just in the last year, our census of patients seen grew by 15%. We saw 1,122 patients last year. We had over 4,600 medical visits. That includes primary and specialty care. And we saw over 200 children. Over 200 of those 1,100 were children. Through grants and philanthropic contributions and support from either state appropriations or other foundations, we're able to maintain the clinic. We do not receive reimbursement for the patients that we see other than grants and appropriations and donations from individuals that support the work we do. The patients that we see are hardworking people who come to us after searching for health care. And when they come to the clinic, we are able to take care of them and be able to treat them, whether it's a one-time visit and everything's fine and you don't need to come back to next year, to the incredible numbers of patients that have chronic conditions that have gone untreated for a very long time. And through our nurse practitioners and our physicians, we're able to help these individuals. We are able to offer medication assistance so that we work with them to make sure that they have the medication to treat their conditions, that they have the education, that they have the knowledge, that they have the training to know what symptoms they need to be on the lookout for. When do they have to report to their physician something that has changed in their daily condition of the disease. And through doing this, we prevent unnecessary admissions to hospitals, unnecessary visits to the emergency room, and we keep them healthy and working so that they're able to go out and support their families. So the clinic serves as a safety net, we like to refer it, because we pick up and we serve as that net that catches individuals that absolutely have nowhere else to turn. So you want me to talk about a story about a patient?
Yes.
Okay.
Yeah. Give me your best one.
It may not be the best one, but it's the one I'm not in the day-to-day, so I wanted to check with her
Sure.
if she had a better story, but we're going to go with this one.
Okay.
And she's on our video too.
Okay.
The girl is on the video.
Excellent. Okay.
Okay. Oh, that's the AC. Okay. One example of a success story of someone seen here at St. John Bosco Clinic is a young woman who came to us when she was 19 years old. She had been diagnosed with diabetes at age 15 and was a very brittle diabetic. Her parents were having a very difficult time controlling her disease, obtaining medications, and really obtaining continuum of care for her and follow-up. So she came to us at age 19 with very uncontrolled diabetes and was started to be seen by a volunteer endocrinologist that worked for us or volunteered for us, and he took a very special interest in this young woman. To quote her mother, after coming here and her daughter's diabetes beginning to be controlled, she said she had not been this happy in 5 years because they had finally found a place that really took an interest in managing the condition and not just taking care of her when she was out of control and had to go to a hospital, because that's the way it had been being managed because they couldn't afford medication. Coming to the clinic, we started working with her. The physician tried different medications, different insulin on her, and she became stabilized. And we were able to help her with her medication that she couldn't afford otherwise. And she blossomed. She did very, very well. She went on to find a job. She was no longer a patient here, but is always in touch with us and has been in touch with us, and we know of her life and how well she's doing. And with God's help and with the help of the clinic, we feel that we had a part in potentially saving her life. If not, then just very much improving the quality of her life and her ability to care for her disease. And that is one of the success stories of many. When I was making the decision to come to St. John Bosco Clinic as executive director, I spoke with Sister Edith Gonzalez. Sister Edith continues to be our mentor, our champion for St. John Bosco Clinic. And when I have a hard moment and we have to make decisions, or perhaps we're worried about how things are going at the clinic and whether we're going to get funding or we're going to get a grant, I always remember her saying DP, Berta, DP. And DP for Sister was divine providence. And I think it was divine providence that brought her all those years ago to Mercy Hospital. It was divine providence that we met, and it was divine providence that she took such an interest in this clinic and in the work that has been done through St. John Bosco Clinic since 1992. Sister Edith was an inspiration to all of us here, to the staff, to the volunteers, and there isn't a day that goes by that we don't think of her, think of DP, and it brings a smile to our faces. She had a very, very deep understanding of human nature, a very deep understanding of the needs of people. And she opened her heart to everyone. It did not matter to Sister Edith who the person was or what that person's life has been. She opened it up and she guided us and allowed us to really grow, not only professionally but spiritually, as we care for those we serve. And for that, I will be eternally grateful to Sister Edith for having taught me such great lessons. And I want to cry.
That's beautiful. That's perfect. You can't improve
I
upon
can't.
that. That's great.
I cannot talk about Sister Edith and not cry. We still cry. Luz and I had somebody come in one day, and we were talking about Sister Edith, and then the two of us just started to cry, and all staff here would do the same thing. Just so you know, Luz, who's the supervisor here, and she's really runs the day-to-day operations because I'm out looking for money.
Right.
And funding and just overall administration. But when Luz came, she didn't know she wanted to come work here. We had worked together at Mercy for 17 years. I thought she would be perfect for the job. And she goes, but it's far. And she walked in, and it was that feeling of overwhelming, this is what I want to do.
Yeah.
And so she's there.
That's great.
Yeah.
Right.
Yeah.
And she continues to work
Yes.
through you.
Yes. Yeah. Yeah. We miss her very much.
Not bad.